So currently, prostate cancer, specifically cancer that is spread to other parts of the body, has a low survival rate at about 35% 5 years post-diagnosis. My research aims to improve the outcomes of these patients. I do this by looking at their clinical features, for example, the age, the weight, and the blood test results, and I combine this with imaging features of the tumours, and that is the size of the tumours and the surface area along with other features. From here, I use statistical analysis techniques and AI to try and figure out which of these features correlate the most with the survival of the patient.
What we're interested in is understanding how the disease is going to progress much earlier in its course. And we're trying to do that using imaging features. And the reason that's important is because images are non-invasive. So there are other techniques that we can use which might potentially be invasive for the patients. But if we can do that using just images, then we have a much better chance of avoiding these sort of invasive procedures. We also want to increase quality of life as well. And Kaylee's project is looking at survival outcomes, but we have other projects where we're actually thinking of improving quality of life in general.
The future of cancer treatment and cancer medicine in itself is going to be in the ability to provide patient-specific treatments. And the current work that Kaylee is doing is a prime example of that. What a lot of people aren't aware of is that we currently are performing some world-leading research here in Perth, and in some instances are the best in the world. We have quite a lot of well-known, recognised institutions like Oxford University, Harvard Medical School, University of Japan, reaching out to train their individuals on how we work and how we think because of the quality and calibre of the work that we do.
At BCGX, we're always looking for opportunities to have a positive impact on the communities in which we work and live. And sponsoring talented students like Kaylee is a great way for us to do that. It's quite exciting to see that these complex techniques from the field of analytics and AI can have such a positive impact on patient outcomes.
So we're actually extremely lucky to be based right in industry. So our group is actually based at Sir Charles Gairdner Hospital. And the benefits that gives to us is that all the projects that our students undertake, including Kaylee's project, but also lots of other projects that we have, come straight from the doctors that work here and the medical physicists that work in clinical practice. So we don't have any students that are doing projects that are not related directly to improving quality of life for patients.
My research aims to improve the outcomes of these patients. So by finding out which features might correlate with survival, we can inform doctors' decisions for treatment and improve these outcomes.